Okay, so we did hepatitis vaccine and colorectal cancer by Keaton Sayers, Jamie Pickens, Bonnie Martin, and Jensen Keller. Some of our learning objectives, students will be able to understand what hepatitis is and how it is transmitted and why you should be vaccinated against hepatitis and who should be vaccinated, and then understand what colorectal cancer is and who is at risk, and then know when to get screened for colorectal cancer as well as the results of the screening.
So, what is hepatitis and how is it transmitted? According to the CDC, hepatitis A is a very contagious disease that is found in the stool or blood and is transmitted by close personal contact or eating contaminated food. Hepatitis B is transmitted when blood, semen, or bodily fluids enter the body through the sharing of needles and sexual contact, and hepatitis C is spread through contact with blood like sharing needles or other sharps. As you can see in the figure to the side, hepatitis C has the most estimated cases per year, followed by hepatitis B and then hepatitis A. So what's the importance of getting the hepatitis vaccine? According to the Mayo Clinic, hepatitis A vaccines and hepatitis B vaccines is given to prevent infection caused by the hepatitis A and hepatitis B. The vaccine causes the body to create antibodies which fight off and protect against the disease. Some infected people do not show signs or do appear to be sick, but can still spread the virus to others. Hepatitis A and hepatitis B can be spread through infected food or water, contact with bodily fluids by needle sticks, or through a mother to a child.
When and who should get the hepatitis vaccine? So for hepatitis A, infants aged 12 to 23 months, children 2 to 18 years of age who didn't receive the vaccine earlier, and people who have an increased risk for contracting hepatitis A should all get the vaccine. For the hepatitis B vaccine, all infants, children, and young adults, people who have an increased risk for contracting hepatitis B should all get the hepatitis B vaccine. And there is currently no vaccine yet for hepatitis C. What is colorectal cancer and when to get screened? Colorectal cancer is a disease in which cells in the colon or rectum grow out of control. It's also called colon cancer. Polyps may form in the colon or rectum, which may result in cancer. Screening tests are vital to help detect these polyps at an early stage before they turn into cancer. The U.S. Preventative Service Task Force says that adults aged 50 to 75 should be screened. Black males over the age of 50 are seen to have the highest chance to developing this type of cancer.
Risk factors for colorectal cancer. The chances of getting colorectal cancer increases as you age. Other risk factors include an inflammatory bowel disease, family history of colorectal cancer, familial adenomatous polyposis. Lifestyle factors that may increase the risk include lack of physical activity and obesity, tobacco and alcohol consumption, a diet low in fruits, vegetables, and fiber, and a diet high in fat. Results from screening for colorectal cancer. Stool-based tests, which are typically done at home and have to be performed more frequently. These tests, if positive, meaning it shows hidden blood or polyps were found, a colonoscopy will be needed to perform to confirm the finding. Examples of this include fecal immunochemical tests, guaiac-based fecal occult blood tests, and a stool DNA test. Visual or structural exams are done in the hospital as more of a procedure and include more risks. A biopsy will be taken during these procedures to determine if cancer is present and if it is malignant or benign. Examples of this include colonoscopy and CT colonoscopy, which uses x-rays and a CT scan. Okay, these are the questions you should be able to answer from our presentation. So, number 1, what hepatitis can you not receive a vaccination for? A, hepatitis A, B, hepatitis B, C, hepatitis C, or D, all of the above. Question 2 is what age of adults should get screened for colorectal cancer? A, people aged 45 to 60 years old, B, people aged 50 to 75 years old, C, 80 years and older, or D, none of the above. Okay, and lastly, here are references for our presentation. Thank you.